Today I'm going to speak about a fairly common problem that affects a lot of people amongst us, something called tennis elbow. So what is tennis elbow? It's one of the most common causes of elbow pain. The pain is usually felt on the outer aspect of the elbow. If you look down into your elbow, you will see that there is a bony prominence or a bony bump on the outer aspect of the elbow. This is the kind of area where people normally feel the pain. Now, the pain may not be just localized to that area. It may also radiate further down the forearm, into the wrist, or even into the fingers. So what people usually feel is pain that comes on, usually not at rest, but which comes on any kind of movement. It may be pain coming on with even simple tasks such as shaking hands, turning doorknobs, lifting something like a mug or a cup in the arm, holding something tight or gripping something tight, or they can even have pain and weakness in lifting objects. As the name suggests, it's most commonly seen in sports people or even amateurs who start playing racket sports such as badminton very commonly, or even tennis and squash. But it can also be seen in people who do not play these sports, in professions such as carpentry, plumbing, people who twist screwdrivers, or even among ladies who do a lot of cooking and cutting. Basically, when they stir the ladle or they do a lot of chopping and cutting, even in these people, it's fairly common to get this problem. The other group of people that I have seen having this problem is people who deal with computers and use the mouse a lot, like IT professionals, or if you're an office-based job where you have to use and move the computer mouse around. What happens is this leads to a position of keeping the wrist and fingers sort of in a slightly extended position most of the time. And this leads to a shortening of the muscles of the forearm. And this can increase the chances of a person getting tennis elbow. So what are the risk factors for developing this condition? One of them is age. It's most commonly seen in individuals for between 30 and 50 years of age group. The second risk factor is occupation. As I said before, occupations which involve a lot of manual use of the wrist and hand and forearm to do their activities, they tend to be at higher risk. And the third risk factor is sports, mainly racket sports, or any sport which involves a lot of twisting of the wrist, like for example bowlers, or any other which involves a lot of twisting and pulling. So although it's called tennis elbow, we often notice that the elbow movements are relatively pain-free and full range, it's not limited. Most people have a problem when they use their wrist or move their fingers. The reason why this happens is because the muscles which sort of move the wrist and fingers start from this area, which is the outer aspect of the elbow, and then move down the back of the forearm into the wrist and the fingers. So whenever there is any kind of twisting movements in the fingers or the wrist, it tends to activate these muscles. And because of repetitive strain and repetitive load, the muscles at the attachment around the outer aspect of the elbow tends to develop micro tears. Now, in most cases, the tears tend to heal up if you just rest it and take the appropriate treatment. But in some cases, this can become a chronic problem and lead to a long-term pain around the lateral aspect of the elbow. So once we understand the cause of this problem, it's very easy to understand why players of badminton, tennis, and squash, which involves a lot of flicking movements of the wrist, tend to get this problem, because when we do this kind of rotatory movements of the wrist, it puts a lot of strain on the forearm muscles and hence the elbow indirectly, leading to this problem. So what do we do once we think we have got a tennis elbow? Well, the first thing to do is to stop the inciting activity, to stop the sport that causes this activity and take a break or rest from this for a short period of time. The second thing to do is to ice the area, which is the outer aspect of the elbow. You can basically ice about 5 to 10 minutes, 2 or 3 sessions a day, and that will help to cool the inflammation down and will help in quicker recovery of the problem. The third thing to do is simple forearm stretching exercises. The idea is to stretch the muscles which are at the back of the forearm. And if you look up the internet, there are a variety of sites which show you the exact method by which you can do these forearm stretching exercises. You can do it as often as you can without causing any further damage. Then you can try and take over-the-counter medications like anti-inflammatory medicines, both as tablets or orally, as well as topical cream application over the lateral or outer aspect of the elbow. So when do we need to see the doctor? If you feel that you have done the above measures, icing, resting, stretching exercises and taking some medicines, and the pain is not getting better in spite of these measures, after about a week to 10 days, then that's the time to visit your orthopedician to make sure that it's nothing more than just the tennis elbow, and if there are any other measures that can be done to treat this problem. So the doctor might usually request x-rays after clinical examination. X-rays are usually normal, but in some cases can show a bit of extra calcification where the muscles are attached around the outer aspect of the elbow. The doctor might usually give you some medicines which are anti-inflammatory as well as pain-relieving medicines, and also some supplements which may help in recovery and healing of the muscle ends, which are the tendons. Along with that, physiotherapy is usually quite effective if done in the early stages. This may involve things like stretching exercises, ultrasound therapy, TENS, and improving techniques if you're playing sports to prevent any further recurrence of the problem. Now, in most people, tennis elbow is a self-limiting condition. It tends to get better over time, and if you take the appropriate measures at the very beginning of the condition, then usually it settles down without much of an issue. But in some people, it tends to become a chronic problem. And in spite of all these conservative measures, the pain tends to persist and tends to become an impairment to the normal functioning and use of the forearm and hand. So in such cases, then we tend to think about more invasive measures. There are things like injections. Now, injections can be a steroid injection. It could be something called dry needling. Then there is something more recent, which is called a platelet-rich plasma or PRP injections, which are used, which is where you take the patient's own blood, and that is sort of driven through a machine, and then you take the growth factors from that, and that's injected into the offending area to help in better healing and recovery and treatment of the condition. So finally, if nothing else works, in spite of all these measures, then there is a surgery wherein we tend to open up the outer aspect of the elbow, clean the area, remove all the degenerative tissue, and then reattach the muscles back to where it should be normally attached. That usually solves the problem. This brings us to the end of this video. I hope this has been of use to you and you've understood a bit about this fairly common condition called tennis elbow. So as always, remain healthy, keep fit, and keep moving. This is Dr. Vinod here signing off. Namaste. If you liked this video or found it useful, don't forget to like, share, and subscribe. And if you want to be notified of further videos coming up, please do press the bell icon which is next to the subscribe button.